it's Christina Masseri, and today I'm going to be performing my assessment of the hair, skin, and nails. So I'm just going to show you the environment which I'm working in. It's just our extra room upstairs. Okay. So before beginning, I just want to make sure I have my patient's consent. Okay, perfect. So when we start the assessment today, we're going to do inspection of the skin. So I'm looking, and it looks normal throughout. There's no abnormalities that really stick out to me. I'm checking his pigmentation. It's pretty fair with a little bit of pink in it. So I would say there's no hyper or hypopigmentation that I should be made aware of. Next, moving on, we are going to move to the temperature of the skin. But before this, I would just make sure that my patient's in a gown while we're actually doing this, and I would drape it so only the necessary portions would be showing for each assessment. Okay, so in order to do the temperature, I feel with the back of my hands. I go from the top to the bottom, noting that there's an even temperature throughout. It's not too hot, it's not too cold. Next, we're going to be checking for moisture on my patient. So the moisture is good. There's no excess that comes off on my glove, so he is dry. Next, we're going to be looking at the texture of his skin. So again, feeling it. His texture is very smooth. There's no rough patches on his skin. It's even throughout. After texture, we're going to be feeling for thickness. Again, like I said before, each side feels pretty equal. There's no spots that are thicker than others, but the general places to look would be on the elbows and on the soles of the feet, which again, he is pretty equal. There's no real spots of thickness. Next, we would be checking for edema on the patient. So I'd be feeling for pretibial edema. So he has none, so it would be a 0. But if he did, we would grade on the scale up to 4. After edema, we are going to be checking for your skin turgor. So we'd be feeling under the clavicle, give it a nice little pull. His is good, it rebounds quickly. Next, we're going to be checking for vascularity and bruises on the skin. So to me, there's nothing visible right now that I would consider a bruise, but he does have some vascularities, which is normal. But if there were a bruise, I would be making sure to document the size, shape, location on the body, everything like that. Next, we would be checking for lesions on the body. There's no apparent lesions to me right now, but if there were, again, I would document the size, shape, location, distribution, color, and we would use a tape measure in order to measure the length of the lesion. So moving on, we're gonna be now looking at the hair of the patient. So I'm feeling the texture of it is smooth. The distribution is equal throughout. He has full eyelashes as well as eyebrows, and he does have a little bit of facial hair, which is normal for a male. So now we're just gonna be checking for lesions in the hair, lifting it up. Good. I would document any lesions that I find, but I'm not noticing any right now. And finally, we're gonna move on to the nail portion. So we would just be checking the color of it, the shape, so they're pretty pink, they're a rounded shape, and the texture of them is smooth. I'm going to now be checking for the capillary refill on my patient. We do this on the hands and toes. And they're all less than 3 seconds, which is normal capillary refill. And finally, we're just gonna check for clubbing. So I'm just gonna have you put your thumbs together. And we see the triangle, which is a good sign. So I think that concludes my assessment of the hair, skin, and nails. Thank you.